Up to 10 AFL players are on their second strike in the league's three-strike system of testing for illicit drug use. The revelation comes at the end of a difficult week for the AFL and even more so for young Hawthorn player Travis Tuck, the first player to be punished for his third transgression of the illicit drugs rules. His case has highlighted the issue of depression and drug use among young people and sparked debate about who should be informed when a player is first found to be using illicit drugs. He's 22 years of age, the son of an AFL legend, and this week he's been the subject of intense scrutiny. Suffering depression, his life reached a crisis point last weekend when he was found unconscious in his car after a drug overdose. For Travis Tuck, it meant a third strike under the AFL drugs policy and the public outing of his problems. For the football community, it's led to the examination of some complex issues.
What it's done is been able to correct a couple of fallacies out there that this week's game is life and death for our footy club in terms of it being a cutthroat final, but probably more importantly Travis's illness is a genuine life and death situation. So it does give us an opportunity as a club to actually take stock a little bit and just understand that whilst this game is absolutely critical in terms of our aspirations, compared to the actual life itself, it's not very important at all.
We might not be talking about Travis having a third strike. We might be talking about a young player having lost his life.
This is how the AFL illicit drugs policy works. At the first positive testing of illicit drug use, the player's club doctor and the AFL's medical commissioner are advised. A suspended $5,000 fine is imposed and counselling and target testing begins. At the second strike, an additional sanction of 6 matches is imposed and still suspended, and more intense counselling is ordered. At the third strike, the player is ordered to appear before the tribunal. The $5,000 fine is also imposed. It's only at the third strike that the club officials are informed, and it's this aspect that has riled many in the code, particularly Tuck's own club, Hawthorn.
And the policy would not exist if we told players we're going to tell people at your club automatically every time. It's up to the player to decide, as the way it works, as to who he wishes to involve in his treatment.
The AFL says, and Adrian again says, oh, well, any of these players can go and tell whoever they like. It's just our policy not to tell the club. The reality is that AFL doctors inform the players not to tell anyone.
There's been a chorus of outcry from club officials and coaches that says the AFL's code of silence until the third strike is wrong.
If the illicit drug policy has to go because of us needing to find out earlier, then it's probably not a good outcome either. So I don't really know the answer, albeit that I do know that if we were able to support Trav a little bit earlier then maybe last Friday night wouldn't have occurred.
Let me assure you, finding out about this issue 48 hours ago has been frustrating. And fair to say, it's been very, very difficult to deal with, not having any knowledge of what Travis has been having to deal with, and obviously having a medical issue as well.
If we're going to help young players, I think key people at football clubs need to be informed so that we can do something better. And I don't even say we as in a coach. Maybe I'm the last player that should know about it. But I'd be very surprised if a bloke like Jeff Walsh at Collingwood shouldn't know something about it, or the players' parents should know something about it, or the psychologist should know something about it.
Professor David Loveman runs the Turning Point Drugs and Alcohol Centre. He's a supporter of the AFL policy and would like to see it expanded to other sports codes.
Around 12% of 15 to 25-year-olds in our community will have an alcohol or drug problem. Yet only less than 1/4 of those will actually seek professional help. So there's a huge issue, stigma around alcohol and drugs. There's a huge issue about people failing to come forward and seek treatment. This is an issue that's endemic in our community. And so I think where the AF policy is excellent in that regard, it identifies people early. It says, you've come up with a problem, we want you to go and get adequate treatment support. It lets the person know, it gives them the opportunity to talk to friends and their family. It allows them to talk to their employers if they want. But most of us, if we were in the workplace, certainly wouldn't want that information shared with most of our work colleagues.
Apparently in a feisty mood.
As well as being president of Hawthorn Football Club, Jeff Kennett is also chairman of Beyond Blue, a national depression initiative. He knows a bit about depression and is angry he only found out about Travis Tuck's illness and drug use after the third strike. He says while men often find it difficult to talk about such personal issues, it's helpful when they do.
I think there are a lot of players who are now starting to say, we want to have the opportunity of helping each other rather than only finding out on third strike. You kill a career, but you might actually be dealing with an overdose, you might be dealing with a death. And at that stage, you can't honestly say to yourself, you've done everything possible to help this individual.
The interesting thing there that I'd like to say is that 10 years ago, we wouldn't have been talking about depression in the public arena. If people had problems with depression, nobody would come forward, nobody would admit to it. And certainly, there's been a whole series of community awareness initiatives over the past 10 years that's allowed us to really think about the issues of depression, identify when people are having problems, and encourage them to get good help. That doesn't occur at the moment in the area of alcohol and drugs. It's polarised, it's stigmatised, and people are afraid to get help.
And anyone seeking alcohol and drug assistance can call Direct Line on 1800 888 236.